For the closing interview of our World AIDS Day show, I'll talk with Dr. Michael Harbour, whose Palo Alto practice supports many in our community living with HIV and AIDS. We'll discuss current HIV treatments and what the future may offer.
A fine close to a full show.
We are at the home of Dr. Michael Harbour. Dr. Michael Harbour completed his medical school training at Georgetown University School of Medicine in Washington, D.C. He was a research fellow at the NIH and completed his residency training in internal medicine at Boston City Hospital, and then accepted a Harvard Medical School appointed position. He is now at Stanford University School of Medicine as Clinical Associate Professor of Medicine. Dr. Harbour is a full-time clinician in the Positive Care Clinic at Stanford. His clinical interests include the application of HIV research into clinical practice as well as participating in HIV clinical trials. Michael, welcome to the show. What are the new medications to combat HIV AIDS?
Well, we've had several new medications approved over this past year. Two are in the protease inhibitor class, and one is actually a combination tablet that includes one drug from the non-nucleoside class and two drugs from the nucleoside class. And the combination of that tablet is a single fixed-dose combination, one pill daily. It includes Sustiva and the drug Truvada, and the brand name of this is called Atripla, so it's one tablet once daily. The two protease inhibitors that are new are Tipranavir, which goes by the brand name Aptavis, and then the protease inhibitor Darunavir, which goes by the brand name Prazista. Both of these drugs are given with a bit of Norvir to boost their levels to help the patient overcome resistance. Both of these drugs specifically have been approved for advanced patients who have failed previous treatments before that. So we have those new drugs that have been approved in the past year.
Great. What advice would you give to someone who was recently diagnosed as HIV positive?
Well, first and foremost, getting diagnosed in 2006 is a lot different than it was 5 years and 10 years ago.
How so?
First, it's not a death sentence. Hopefully, the patient will have a chronic, manageable illness. We have great treatments, and if those should fail, we have treatments that can be given beyond that. So it's first and foremost, patients need to know that they're really going to be okay. Second is they really need to get their health insurance in order, make sure that if they have insurance, access a doctor. If they don't have insurance, they can receive care through the county which they live in, Santa Clara County or San Mateo County or any of the counties here in Northern California have HIV programs specifically for patients who don't have health insurance, and they need to follow their doctor with regular appointments and lab works to know where they stand.
And then exercise and nutrition are probably factors also?
Exercise, nutrition, proper sleep are all factors that are important for good, healthy living.
So tell us, what services do you provide at your Positive Care Clinic?
So the Stanford Positive Care Clinic is a comprehensive clinic. We provide medical services, but also psychiatric services, nutritional services, counseling and nursing services, and of course all the referral services that Stanford University can offer.
So kind of the full spectrum, the whole wellness spectrum.
Exactly.
So how can someone find out about these new drugs and stay informed on the new stuff as it comes out?
Well, staying on top of the new drugs and the new treatments actually is a lot easier than it used to be. There are magazines that patients can subscribe to.
Are there any websites you might recommend?
Websites that people go to. A very popular one for patients are thebody.com, thebody.com. One that I like as well, that it gives a little bit more updated research, is called hivandhepatitis.com.
All spelled out as
hivandhepatitis.com.
Okay.
So those would be two examples. Patients like Pause magazine, and they can get information through this as well.
Do you still find people have misconceptions about HIV AIDS?
I think probably the biggest misconception is that people feel like when they first come in that they're going to die once they have that diagnosis. And after you dispel that and they kind of get over the adjustment of what it's like to be HIV positive, they can then look at that disease as a chronic illness.
How long have people been living with AIDS?
I've had patients who've been living with AIDS now for 25 years.
Wow, 25 years.
Exactly, which is a long time. We've just recently celebrated the 25th anniversary of HIV, if you can call it an anniversary. It's more of just a marking in time, if you will. But people have been doing this for quite some time, and every day I never I never cease to be amazed by how well people are continuing to do.
Well, great. Michael, we are out of time.
Be sure to join us again next month to see Raymond's interview with former New Jersey Governor James McGreevey, right here on the next edition of Outlook Video.
Do you think Nancy Pelosi will be the new Speaker of the House?
I pray with every fiber of my being, and I think she'll be an extraordinary speaker.
Roberta, we made it. Dare we bask in the glow of our WAVE Award?
No basking, Tom. We need to keep working on winning the next year's award. Thanks to all the viewers who joined us, and be sure to tell your friends about award-winning Outlook Video.
We close by giving credit to all the great volunteers who helped make this show and our 2006 WAVE Award possible, along with a holiday greeting from the Castro, from our own Aaron Bruno. Thank you, and be sure to join us again next month.
Bye for now.
now.